Welcome to the Much More Than Medicare podcast. My name is J.O. I'm the author of Maximize Your Medicare, Certified Financial Planner, and I run GH2 Benefits. Don't forget about the live webinar, May 18th. It's Tuesday, 2 p.m. Eastern Time. Registration is required. The link is in the text below the podcast. For persons who are subscribers to GH2 Unfiltered, you will be able to access the recorded version, as well as don't forget about the free book offer. I'll pay for postage in the lower 48 states. In today's podcast, we're going to get to the American Rescue Plan, the tremendous change that it has made to the health insurance markets, and what it does and doesn't do for certain individuals. All that is coming up next. Today's first segment is dealing with the American Rescue Plan Act. I'm going to get to what it doesn't solve later. So in brief, basically the American Rescue Plan allows you to enroll in individual health insurance anytime between now and August 15th. August 15th. Some people have thought that it's May 15th. That's actually been extended to August 15th. Now, what this means is that people should check out links that are below the podcast and check out whether or not you can qualify for the tremendous discounts which are available. I recommend absolutely every person who has enrolled or considering health insurance to check out the prices. Rule number one of financial planning, again, is don't give away free options. Literally, I can tell you that the website traffic at GH2 Benefits has been increased by 5 times over the past month. Now, the reason for this is that for many people, these tremendous discounts on health insurance premium can make it worth it. In other words, a lottery ticket is worth it if the lottery ticket's price is low enough. And that is in fact what has happened here. Meaning, not to compare insurance to gambling, because, for example, if you are type 1 diabetic, your probability of requiring health care services and therefore incurring the cost is high. As a result, the value to you, meaning the probability of getting benefits to a type 1 diabetic, is also high. So it's not really gambling where you're going in there in pure randomness, because why? You have specific information, specific scenarios in mind that could affect you. And oh yeah, by the way, one of those scenarios is that Father Time continues to go forward, which is true for everyone. Anyway, let's go back to the types of savings. You know who you are, and for the first, let's cover the obvious. You're 63, you live in Texas, Arizona, you live in a high-cost state like Florida. Health insurance, the full sticker price without the subsidy, you're talking about high 3 digits a month, 800, 900, in certain persons over $1,000 a month for the highest quality plans. For someone who lives on a moderate income, now the ARP, the American Rescue Plan, what I'm going to call Biden Care for the rest of this podcast, has substantially increased the tax credit, which pushes down your health insurance premium. And by how much? I've seen 100% lower. Yes, health insurance at zero. So now you're 63, you're Mr. or Miss Perfect, you've never been sick, you never go to the doctor, but nevertheless, you understand you're 63, you're not 29. The probability of getting ill and requiring healthcare services has increased compared to when you were your 29-year-old self. At $0 a month, probably a good idea. Don't give away free options. Okay, who else? And that's kind of self-evident, because I can see that from the profiles of the visitors to GH2 Benefits, which is, people are putting in their age and their location. That's just very clear. I'm happy that, some of our efforts to get the word out have been successful. This also applies to other age divisions. On this end, it becomes less obvious. Let's just call yourself, go back to the 28-year-old, your 28-year-old self. Your 28-year-old female, without being overly, biased, etc., etc. Let's just call it simple biology, right? You can expect a child. You are in that age. You're a 20-year-old female, right? That is the age. You are in this age division where this may be in your personal list of things that may occur in the near future. Yes, health insurance now affordable depending on your age, your household size, and where you live. There's no shortcut here, but it's also not overly difficult. You can go to the videos on the YouTube channel, the Much More Than Medicare YouTube channel, where I'm going through how you have to be careful, but nevertheless worth the exercise. 28-year-old male, same thing. You're Mr. Perfect. When I was 28 years old, I can tell you precisely how many times I went to the doctor. I can count them. 0. Right? I never went to the doctor. Did I have a special circumstance? Yes, my father was a phone call away. That said, the fact of the matter is, depending on your income, you're talking about the lowest cost health insurance premium available. This is valuable stuff for persons who understand that a free option should not be turned away. Let's say you already have insurance, and I'm getting this quite a lot, meaning that, who isn't checking today? We have some pretty good evidence already, like I said, due to the fact that we've got so much data now on GH2 benefits. What we're seeing is the following, which is that people are saying, yeah, Jay, I already have health insurance, so, I'm just not going to mess with it. I can even tell you that my personal friends are telling me this directly to me. And I'm just thinking to myself, yeah, that doesn't make a lot of sense. Because you can, even if you have the subsidy today, you can have increased subsidies under the American Rescue Plan Act. This is very important. Since this is a tax credit, you could say that I'm just going to ride it out through the end of the year and then get a bigger refund next year when I file 2021 taxes. This is a flawed way of thinking about it. Flawed. Why? It presumes entirely two things, and tons of things can go wrong. What are those two things? Number one, it presumes that you have done your taxes right next year, right? It presumes, and number two, it presumes that the IRS has also processed your taxes right. And that doesn't even address the number one thing, which is that when you add 1 and 2 together, your punchline is, look, I'll take the discount today with certainty and value that much, much more than an uncertain dollar in 12 months' time. This is simple common sense, everyone, right? We don't need all my fancy degrees and, option theory, background, etc., etc. We don't. If you can get $100 a month lower premium, that $100 a month is yours today. You know it. No one will take it away from you. That said, if you're going to rely on your tax filing for later, that becomes a lot less certain. So I don't like cliches, but the cliche does work. A bird in a hand is more valuable than 1.3 birds, in the bush or something like that. That now applies. So where am I wrong here? There are exceptions, and we need to be pretty careful here. Let's just presume that you have health insurance, you get the subsidy or not, Okay. And yet there still be situations when people would come to me and I say, Mr. X, Miss X, you have to stay right where you are. So if you change plans, if you change plans, then what will happen is your counters, and we're just going to call them counters, towards your deductible and out-of-pocket maximum are very, very likely to reset all the way back down to zero. This is a problem for those persons who, for example, have had like knee replacement surgery in January, right? You've already spent a lot of money to pay for the deductible. So you need to be careful and think about your individual situation. That's why I don't suggest that people just, click on my websites and then, enroll without calling or sending me an email and checking through the facts. There's no real shortcut to this, right? Because, there are many, many places in between. Because the amount of decline, meaning the reduction in your health insurance premium, can be so great that even if you have paid towards your deductible, it may not matter. That's how big these reductions in health insurance premium can be. Let's talk about COBRA here. For those people who do not know, COBRA is, a Department of Labor kind of rule for those persons who have lost health insurance as a result of involuntary termination or reduction in hours, which disqualified you for health insurance benefits. The ARP and the other legislation has basically meant that the employer is required to pay for your health insurance premium between the months of April and the end of September. That 6-month period. Now, you got to be super careful here because it's been my experience as a result of the past few weeks that employers are not well informed about this. This is pretty important, right? Because now basically they're saying, well, we don't have any idea, blah, blah, blah. And then you're sitting there thinking that you should be entitled. Inside the text of this podcast, you can find some guidelines. There are links to those guidelines. Be sure to go and check them out. You can also reach out to us for our guidance here because we're pretty convinced. And through the end of September, you're fine. Now, people say, okay, well, I need to enroll today in order to because I want to get these subsidies as a result of that I've spoken about in the other segments so that, we can get these higher subsidies beginning on October 1st. That is not the case. Those are still preserved. They're still preserved because you've got a different pathway into individual health insurance, and that is life qualifying event. So now you can see the attachment points. If you are on COBRA or if you've been lost your health insurance from your large employer, and then actually by large employer in this instance, it means by 20 full-time employees or more, then the employer is required to pay. Don't worry, the employer gets a tax credit and they get it returned to them in that path. The bottom line for you is that the employer pays, but employers simply don't know enough about this. That causes confusion for those persons who are otherwise entitled. To you, I'm again restating that you don't have to be worried about what happens at the end of September because you have a life qualifying event, a federal rule which protects you. You can enroll in individual health insurance and get the maximum subsidy at that point in time. You can hear that this is, a fairly convoluted set of dip switches. And this is kind of why, we've got this website. People are going on and they're saying, find out if you have a HEP subsidy. And, I'm sitting out there and the websites are built to say, hey, it's easy. And just go ahead and click around a bit and then you can go and shop yourself. And this is, the Amazonification, if you will, of, our society. And I get all that. And I can understand that there are other reasons. People don't like me. They don't want to talk to me. They think that, this, that, or the other about me. and other financial people. That's what I really mean. But and I can understand of that. Some of that certainly is earned. I would tell you the following: is that you should listen to the podcast and the YouTube channel, etc. Right? Because really, for the consumer, what you're trying to do is you're trying to ascertain, you're trying to figure out, here's your ballpark, and that's really what the website's good for, and these quoting tools are good for. They are good for, like, when you go onto eBay or to Amazon. You don't know about some particular product. You want to find out about the context of price to find out if you're in the right ballpark. Let's just say, for example, you are 30 years old and you're a single parent. You have a moderate income. You want to find out, and you have one child. Well, you want to find out whether or not you can afford health insurance with the subsidy. Yet you don't have tons of money because you've got other things to do, because you've got to pay for things for your child. All of that's understandable. And, the websites are very good for the filtering system. However, and you knew that was coming, right? Which was that, the earlier parts of the podcast, I guess, 15 minutes at a fairly rapid rate, is you can hear that there are a number of dip switches. You kind of just think about them as dip switches, right? Because you've got a bunch of details here which are pretty big, meaning that if any one of the single dip switches isn't exactly right, everything, all my conclusions, all of my guidelines here on a simple podcast are now either invalid or, in fact, by invalid, what I mean is it could even be bigger, meaning that your benefits, your prices can be lower. What you get can even be greater than what's being shown on these guidelines, on these, websites and things like that. That's just something to keep in mind here, and I'm going to close it out there. gh2benefits.com. You can get your free guideline start there. There's also contact forms. I encourage people to at least do the look and then nail down the details. Whether you have your own broker, whether you have your own advisor, make sure that they have a feel for all of these details that I have spoken on. And this is just the beginning. I can't make a 5-hour podcast. No one would listen to it. People barely listen to this 20-minute podcast. So as a result, you need to just this is a set of guidelines so that your radar is on to all of the moving parts. I'm Jay. I'm the author of Maximize Your Medicare, certified financial planner. Be sure to like and subscribe to this podcast. You can get it on Spotify, Apple Podcasts, anywhere that podcasts can be heard. Thanks.